My name is Dr. Eric Willmarth, and it's my hope that if you're watching this film, you're a serious student of hypnosis. Defining hypnosis has always been difficult. In this next brief segment, I'd like to introduce you to 12 world-renowned therapists and researchers as they try, in their own words, to define how they see hypnosis.
Well, it's really a multi-dimensional phenomenon, I believe. I think that most of the theories are not really theories, they're descriptive descriptions rather than true theories. I personally believe that there are some socio-cognitive factors involved, such as expectancy and context effects. I think that they are probably the most prominent for people who are low or medium in hypnotic responsiveness. I believe that the further up the hypnotizability continuum you get, the more you find that factors like dissociation and neurophysiological and hereditary factors are part of the equation. I think that some of the research that's been done on the brainwave activity that's going on with hypnosis, a couple of different studies that have shown that there's a strong genetic component that's passed on with heredity. I think that they clearly indicate that the brain is hardwired differently in many people who are very highly hypnotizable, and that some of the contextual factors, the relationship factors, the expectancy effects and some of those things probably are not quite as influential, still play a role, but not as influential in high hypnotizable individuals. So I think it's really a pie with different size pieces that vary depending on the person and what their responsiveness level is.
Well, I think of hypnosis as a state of aroused, attentive focal concentration with a relative suspension of peripheral awareness. I think of the sort of, while I'm looking in a camera, the telephoto lens model of hypnosis and consciousness, that it's like looking through a telephoto lens. What you see with great detail, but you're less aware of the context, you're less aware of what's going on around it. And to that we attribute dissociation, separating the center of your attention from what the context of it is, and to some extent the suggestibility associated with hypnosis too, because you're less likely to think through the implications or consequences of a suggestion or an experience, and you're more likely to just process it for what it is. So I just think of it as highly focused attention with a suspension of peripheral awareness.
I guess hypnosis is one of those things, I for sure know it when I see it, but I don't know if I can tell you precisely what it is. The way I think about a definition of hypnosis is that it's not exactly just one thing. It's a complex phenomenon. But I think, from my view, I define hypnosis as an altered state of consciousness characterized by an increased ability to respond to suggestion with a sense of involuntariness. So for me, I believe in the concept of hypnotizability. I believe that a person who is able to respond to hypnotic suggestion, it's with a sense of allowing it to happen, a sense of involuntariness, an effortless kind of responding. And I believe that's part of what we mean when we talk about the trance state, that it's kind of a therapeutic dissociation, is how I think of the concept of trance.
Is that hypnosis is an altered state of consciousness which has an adaptive value both biologically and socially. That's the brief essence. And if I would give a kind of a little bit more extended version of it, I would say hypnosis gives us a chance to get into a very special, intensive interpersonal relationship with another person. And the nature of this very close interpersonal relationship is very similar to the relationships we usually have only with the most important persons in our life, like our parents or lovers or whatever. And the important thing is that the context, how we meet our patients or our subjects in experimental conditions, gives us a chance to be in a very safe condition, and within these safe conditions we can enter a special regressed relationship where we can induce a state where we can pay attention to each other as closely as we usually do only with those very important, the most important interpersonal relationships of our lives. And this way, we begin to be more sensitive to each other's reactions. And when I'm speaking about more sensitive to each other's reaction, I really mean it, because probably you know we study the interactions, so we really recorded hypnotists' reactions and hypnotists' subjective experiences as well. So we know, and we have sound data proving that there are very important changes going on both psychologically and physiologically, not only in the hypnotized individual, but in the hypnotist also. So I would define hypnosis as an interaction inducing a specially altered state of consciousness where both participants of the interaction enter into a very intensive interpersonal relationship, which is characteristic only of our most important interpersonal relationships in life, which have mutually regulating functions. And this mutual regulation is very important because that gives hypnosis a role in altering physiological states of the body too. So that's why we can have a healing effect in psychosomatic medicine, for example. So hypnosis can open new horizons for both participants of the hypnosis interaction, actually.
Typically say if you have to condense it into one word, it might be dreamy. It's not like dreaming per se, but there are some qualities that they have in common. A sort of like with dreams, a kind of suspension of the usual day-to-day kind of critical thinking and executive functioning that people have. Like a dream, sometimes during hypnosis, one thing can mean another. Certainly the experience of volition and agency is changed. You know, a dream is a visitation, and in a sense, a hypnotic experience is a little like a visitation.
I'm not convinced that either side or either camp, the so-called state, non-state camps, that either side really has all the cards. And I think it not only is fruitful for cross-fertilization of ideas in terms of research as well as clinical uses to consider both sides of the argument, but I'm in the tradition of a socio-cognitive approach. And so I'm interested in things like context effects and expectancies and motivations and attitudes and beliefs. But there just seems to be something kind of intuitively appealing about the idea of individual differences and personality characteristics that ought to be associated with hypnotizability. So I'm still encouraged to try to pursue that line of research and try to find some sort of reliable predictor of hypnotizability.
To me, hypnosis is primarily, I guess, a social interaction that asks people to use particular skills, and it's skills that they have all the time and they use in different circumstances, but hypnosis is one that brings those skills out of becoming absorbed, focusing their attention, and wanting to go along with the hypnotist. I think that the fundamental aspect of hypnosis is an alteration of how people experience themselves in the world, that their behaviours don't necessarily change, but that they're surprised and amazed by the quality of their experience. And I essentially believe that that's something that they can create themselves with a little bit of help from the hypnotist, but mostly via their own imaginative skills and attentional skills and ability to just get really involved in these unusual experiences.
Well, I really don't know what hypnosis is. I don't think that some kind of theoretical approach of hypnosis may be useful, at least to date. I prefer a not operational way to approach hypnosis. Let me say something that helps us to understand what can differentiate hypnosis from other different states of consciousness. I prefer to think of hypnosis in terms of a process rather in terms of a state. And a process is a very complex thing. Even consciousness is a process. It is easier for us to say what is a pathological comatose state, but not what is consciousness. And the same may apply to hypnosis.
The way I think about hypnosis is that it's an agreement between a person designated as the hypnotist and a person designated as the patient or client to undergo a procedure or a psychotherapeutic technique where the hypnotist makes suggestions to the patient or client for changes in things like affect, cognition, thoughts and feelings is another way to say that, behavior, for the patient's benefit.
When I think of hypnosis, I don't tend to think of it in definitional terms because I'm not sure any one definition succeeds and certainly has not satisfied everyone in the field. My training led me to the notion of hypnosis as an aspect of persuasion. And so the socio-cognitive model is one that does have appeal to me. But I do think that people have pre-existing propensities or capacities for hypnosis. And that hypnosis can put somebody in what is called an altered state. So I don't feel myself bound by any traditional school. I think hypnosis actually blends all of them.
Yes, hypnosis is an altered state of consciousness in which we're dealing primarily with the patient's unconscious mind. So what the person says consciously means nothing. If they say, I want to stop smoking, it doesn't mean a thing. It's consciously, it's what it means unconsciously. If they say, I'm hoping this pain will come under control, let's hope that they also mean that unconsciously, because if they do, it'll work that way. If they don't, it will not. So it's the unconscious desire for this to work that makes it work.
Perspective was that hypnosis doesn't exist, and that hypnosis is a construct of convenience. It's a title that we put on our experience, and there's three components of experience: a contextual component, a psychological component, and an interpersonal component. So if we look at the phenomenology of hypnosis, we would say that hypnosis was composed of a context where you directly or indirectly define the situation as hypnosis. It's composed of a psychology. The psychology, the individual psychology, is that you change your attention, you modify your attentional processes, you modify the intensity of experience. So the intensity of experience becomes more or less vivid. There's a plasticity of experience. For example, relaxation could be more vivid. For example, the passage of time could be less vivid. And the third component, psychologically, is dissociation. Dissociation in three senses. Dissociation meaning that something just happens, like images just happen, memories just happen, or there's a sense of being a part of and apart from the experience, which would mean that there's a sense of being here and not here at the same time. Hypnotized people often say, well, I was here, I knew I was here, but I was there. I was involved in the imagery of the moment, or I was involved in the memories, and also a sense of destabilization. So if you have a context defined as hypnosis, if you have changes that happen psychologically, a change in attention, a change in intensity, and a change in dissociation, and you combine that with a change in interpersonal responsiveness. The interpersonal side of hypnosis is that people start to respond to the implication of the communication. They start to respond to the meaning of the communication. They respond to the covert level. Now, if you take those 5 factors, defining the context, the 3 psychological changes, and the change in interpersonal responsiveness, and you put those together in some combination. What combination, we can't say. Because some people just change their attention, they'll say, I'm hypnotized. Some people will start to have dissociative experience, they'll say, I'm hypnotized. Some people, you say, let's do hypnosis, you just define the context, and they say, okay, I'm in a trance. Some people need that interpersonal responsiveness to say, I'm in a trance. But if you have some combination of those things, people will say, they will title their experience, I'm hypnotized. And so hypnosis is a construct of convenience, but so is love, and so is curiosity, and so is good humor. They're just a construct of convenience. And by deconstructing hypnosis into its component parts, we can set into motion a series of events that we could call hypnotic induction. And when people start to experience that series of events, then they will title their experience, I'm hypnotized. So I think that it's wrong to think about hypnosis as a singularity. There's no singularity to love. There's no singularity to good humor. It changes over time, and the elements that compose good humor or love or hypnosis change over time. And so thinking about hypnosis as being a scientific fact is a very difficult and challenging thing to do. Hypnosis is more in the realm of a very personalized experience.
You've seen